Hello, good
Hi, everybody.
evening.
Welcome. Welcome to AI Live. We're happy that you are here. We have a great night for you tonight.
Yep.
We have someone here who I'm super excited to have you pick his brain. Okay, so I want to introduce to you Dr. Jordan Plews. Dr. Jordan Plews is someone I met a few years ago in Salt Lake City, Utah. And I tell you, like, we started talking in a room and there was nobody else around. He was so interesting and so compelling. Just having him talk about cellular biology and stem cells and exosomes, and he developed a lot of an entire company around this, and he knows so much about this component of our regenerative medicine. I really wanted him here to help you guys understand what we're dealing with when we talk about regenerative medicine. What are we talking about when we're talking about umbilical cord exosomes versus mesenchymal fat cell exosomes versus platelet derived exosomes? How are growth factors different? All these questions. So Jordan, thank you so much.
Welcome. Thank you.
Thank you.
No.
Credential yourself. Let us know everything about you right now, because in case somebody doesn't know you. But thank you so much for coming on board with
I
us.
know.
Of course, you're too kind. Thank you for having me. Yeah. My background, if you don't know me, I'm a biochemical engineer and stem cell researcher by background. I've been in the field for about 20 years or so, in stem cells and bioprocessing. Did my undergrad and doctorate over in the UK, and then came back to California, where I'm originally from, to do my postdoc before moving into biotech and eventually in aesthetics. I've been in aesthetics pretty much the last 10 years, developing products and bringing them to market.
Yes. Yes.
Amazing.
And
Amazing.
and good products, really good products. So I think what we want to hear from you tonight, and we're going to let you just take the ball and roll with it,
Yep.
is that we want to hear from you everything about what we need to know, being providers who are using these types of products on our patients.
Right.
What do we need to know? How do they work? What are the pitfalls? What are things we need to watch out for? So want you to take this away. Now, everybody who's watching, I want you to make sure that you can type in questions. Please, please do. We want this to be interactive.
Yep.
Type in questions and we will get those answered for you, so
Yeah,
that you can learn
it's
as much as you can from
it's
this.
it's a very, very wild west when it comes to regenerative medicine. The difference between the different exosome companies, and I think you were in one, and just kind of helping us delineate how do we evaluate with so many people. Really, I mean, I go overseas and I see so many different exosome companies, and they're always constantly reaching out. How do we delve through the information? What should we be looking for as a practitioner that wants to bring these into our clinics? What is the science? Is there good science? Because you're going to hear arguments. I'm starting to hear arguments from both sides of yes, no, blah blah blah. But since you are a leader and a forward thinker in the field, we want to hear what's up. Like, give us the scoop.
Yeah.
Yeah, I'll try to do my best here. I think it really starts with setting the stage on how to think about these things.
Okay.
Some of it is even, remembering how we got to where we are today.
Perfect.
And so necessarily delve into the timeline. But I think first order of business is really to think about what we're doing, why we're doing it, and how this relates back to the wound healing cascade, which, hopefully everyone remembers, but I'm just going to give a bit of a refresher on that. I know I have a couple slides here to kind of go through, but stop me at any time if you want to, talk,
Perfect.
ask any questions.
Sounds great.
So let me see here. I'll skip past my background here, but I spent some time in biotech before moving into aesthetics. Happy to take any questions on that later, but I know we only have a little bit of time together, so I want to dive right into really the 4 phases of wound healing and why this matters, because really, a lot of what's done in aesthetics is triggering this well-known 4-phase wound healing cascade. And so understanding which cells are driving each phase is really important, and kind of key to optimizing efficient and complete healing. And it's important to remember the skin isn't comprised of just one cell type. It's this interconnected network of diverse cells that are working together to create healing and repair. And this is a figure I pulled from a 2021 paper I admire, not my own, but it's good because it clearly maps out which cells are active in each phase of the kind of 4 phases of wound healing. And that's a key point, I think, as we move forward. Um, I kind of gave a version of this recently at the American Society of Plastic Surgery. And, some of this might be a little gimmicky, but I think it's really important to use analogies so people remember things and they tie it back to something they know. So I often, refer to these cells kind of like an orchestra. You can think about each cell type as an instrument in the orchestra. And to get that harmony, that effective healing that we really want, every instrument needs to play its part at the right time, the right volume, producing basically the right factors in the right amounts. You don't want one instrument overpowering the rest, and it's not a more is better kind of situation. It's more about balance and completeness. In the same way, a multivitamin provides you a bit of everything your body needs rather than just an excess of one nutrient. And I think that's the general mindset that I don't think is very prevalent out there. I see a lot of kind of bigger is better, more is better thinking, unfortunately. I think that's just kind of the American way. Um,
Yes,
right?
for
But
sure.
right, this is how people think. And so, one of the ways to look at this and go, how do we capture all this in a product or apply it in a procedure? You could grab all of these cells and kind of trigger them or juice them for their factors and try to get the right blend. But it's pretty difficult, right? Each cell type is only responsible for one section of this, and getting all of them to cooperate in the laboratory can be difficult and expensive. So another approach, and this is the approach that I've taken, is using stem cells and progenitor cells, right? So these act more as the conductor of the orchestra, and they are sending signals to talk to all of these. And so it's much easier to work with one cell type that's sort of controlling the others or signaling to the others to get where you want to get. And effectively, there's 2 main goals, I think, that should be focused on. Number one, we want rapid repair, right? We know that as we age, our healing speed is going down, our ability to heal is going down, and we want complete restoration. So we don't want to be left with a scar. We don't want to be left with all kinds of marks. And this really means that you've gone through all 4 phases completely. You're not skipping steps or getting caught in a bottleneck. So, for example, if we go back for a second, if you're stuck in the remodeling phase of this, you probably didn't remodel the skin properly and you're left with a scar. If you're stuck in the proliferation phase, then it didn't heal all the way, right? You're left with maybe a chronic wound, something that didn't close properly. If you're stuck in inflammation, you might be bright red, showing signs of swelling or inflammation, right? I know this is something we've all experienced at one time or another. So there's real consequences to each one of these phases. And I think if we can kind of think through this and how to approach it, it makes a lot more sense. So really, I'm all about the right tool for the job. I'm not here to kind of push any particular brand or product. And I don't think you can even push a single technology because as was said before, every company is different. And every product that they're making, the way that they make it matters. And so I'm hoping maybe we can guide towards asking the right questions and thinking about it the right way. And over the last 20 to 30 years, we've gotten a lot more tools in this aesthetic tool belt, right? And I think when you link them together, really understanding the patient and the procedure, you should end up in the right place. So, on a very high level, the way I refer to this is we want to get the right cells and we want to treat them in the right way to produce the right factors for the job. So if we're talking about regenerative aesthetics, talking about topicals and things that are going to help, this is sort of the mindset. And so that means asking about the cell source. What is it coming from? What is the age of the cell source? Is it a human source or not? Is it compatible or not? What is the process? How are those cells treated? And what analysis or stability has been done? And in other cases, we can talk a little bit more about peptides and growth factors and recombinant. It may or may not be a cell source here. Ultimately, though, it comes down to efficacy and results. and the ease of use, right? There's a lot of technology that is not fully accessible yet. I think for me personally, I felt after doing a lot of work, in a doctorate, postdoctorate on stem cells, that I was impatient to how do we get this technology into the hands of patients? How do we use this in a practical way? And I think the reason that a lot of things like secretomes, exosomes, extracellular matrix are really getting their 15 minutes of fame right now is because these are components that can be bottled, that can be made into products, whereas stem cells or most cell products, you can't really just take that off the shelf, right? You need a very special environment to keep those and culture those. Um, so I like to, again, make very simple analogies here because I think it helps anchor people to what they already know. And so if we think for a minute, like about a damaged building, like an injury, like a wound, right? You have this damage that's occurred that is going to kickstart the 4 phases of wound healing. And you want to first take care of that before moving into kind of preparing for the next phase, which is this hemostasis inflammation phase. And you can see here the damage is done, the fire is out, the immediate injury is over. And now there's this kind of movement of some workers coming in. In the case of a wound, you've got cells coming into the wound bed, often immune cells. You start laying out the wood and the construction materials needed to replace everything here, right? But effectively, you can't really get going with healing until you get the ECM in there. And this is where it's like scaffolding. And so I think this is a really important point that's often overlooked because, again, everyone's talking in terms of I've got the most of this growth factor, or I've got the most exosomes, or I've got the most things in my soup that I'm giving you as a topical. And just like a construction site here where you're fixing a damaged building, if you had 100 times the amount of wood or steel or nails that you need to fix the job, is that actually helping? Or is it maybe getting in the way? Or is it maybe a waste, right? You really need a little bit of everything. And you can't really get the workers into where they need to go without this scaffolding. And so in the case of a wound, we're talking about the extracellular matrix. And most people understand collagen is an ECM protein. They understand that elastin's part of it. They might know that hyaluronic acid is considered an ECM protein, but there's a lot more to it, actually. You have fibronectin, laminin, there's one called Spark. There's a variety here. It's not the one or two that we hear about the most often, but essentially until this scaffolding is in place, healing is going to be sort of stuck here, right? So you can get caught in this inflammation phase and not move forward to the proliferation phase if either your cells are not producing the ECM anymore or they're not producing it as abundantly. And some of these products now, you can basically put ECM in and on the wound bed, and so your cells don't need to make it. And so you're saving your cells a lot of time, a lot of effort, and they can get through to closing the wound, replacing the damaged materials with new materials. Does that make sense?
Yeah.
Oh yeah, I
Sure.
want to buy it. Yes, yes, and it makes
Yeah.
sense that I did a laser resurfacing like a CO2, and put a product that was a platelet derived exosome on one side, and looking at your healing cascade, it looks like it only works in the first component of it. So like my body wasn't taking me through the rest of the healing process. So this really makes sense that we might give them a component, but then our bodies, we got to count on them to do the rest of the work if we don't put it all in there.
Well, yeah, and the other image I often use here is like a bunch of dominoes lined up, where some companies are offering the first or the second or the third domino, but they're expecting your body to fill in the gap with the fourth, fifth, sixth, seventh. And
Right.
that is different for every person. We have different healing capacities at different ages, different health statuses, right? So, from my point of view, you want a more complete system end to end. You should be thinking about what am I doing before the treatment? What am I doing at or right after the treatment? And what are they doing at home? Because the healing is not going to happen instantaneously, right? I don't know anybody out there that gets out of the chair after a procedure and is totally getting the full result, right?
Yep.
Yeah.
For sure.
Yeah.
For sure.
So, assuming all of this goes to plan, you move through hemostasis, inflammation, proliferation, and now remodeling. And the last phase here, if just like a building that's poorly remodeled, you're going to see where the scars are, where things were done and changed. But if things are done completely and fully and you're supporting it correctly, you should be left with a minimal scar, if maybe no scar at all. Like very, very young, we don't scar. And in the womb, we don't scar, right? So I think there's still more work to be done on exactly what the perfect mix is. But certainly as we age, our potential for scarring changes, and it has something to do with genetics as well, a lot to do with
Right.
MMPs.
Mm, okay.
Right.
Awesome.
So I like to bring this up too as just a bit of a reminder. I think we all know that collagen is going down with age, and we talk about that a lot. I don't think there's enough talk about the types of collagen that there are, right? There's many different types. We really, are starting off with a lot of collagen 3 that's converting to collagen 1 over time. The elasticity of the different collagens is different. It's almost like structural steel versus, say, a steel beam that's a bit more flexible. But that's just one component. We have all of these growth factors and different ECM components and enzymes that are going down with age. Again, this is a non-exhaustive list here. But what it really says is that we are dealing with like 1,000-piece puzzle, and we can put one piece in like hyaluronic acid, another piece like collagen, another piece like elastin. It's still a very small piece in a very large puzzle. And so the more we can provide more pieces to this puzzle to recreate this puzzle, the better we get at recreating that youthful healing environment that where we were healing scarlessly and very quickly naturally.
Amazing.
Yeah. So kind of like to your point, Lori, if you only got platelets, you can only expect to get the repertoire or the vocabulary of a platelet, and it's only going to cover you during this beginning phase. And so a lot of people have experienced this. Maybe they got a PRP shot and they said, "Ooh, that was spicy."
Oh, very.
Mhm.
That's very spicy. I
Yeah.
mean that brings up a nice thing because when I go outside the country, really PRP, PRF is not actually very much used at all. And I know from the Asian community, I brought in PRP probably like 12, 15 years ago. And it was supposed to do this stuff, and then I didn't find that it really did that, and so it's fallen off. I'm definitely more in the stem cell exosome range. For those out there that are really still like PRP, PRF, because that's still being propagated here in the US, kind of the difference between your PRP versus even these exosome stem cell products, kind of hopefully they're starting to understand kind of why PRP, PRF to me is very limited compared to something like an exosome and a stem cell product. I mean, I think that that's something we need to really highlight because there's a lot of lack of education because I still hear it. People are like PRP, PRF. And I'm like,
Yeah.
yeah, it's very old school. That's like, so
Yeah.
thoughts on that, on the aspect of it.
Yeah, no, I think you're right. I think I've heard the same thing over the last, I don't know, 5 years or so. It was really popular, I think, in the 2010s. I think Kim Kardashian had a lot to do with it, with Dr. Charles Reynolds trademarking the vampire facial, right? This
Mm-hmm.
became a
Yeah.
big thing. And I think, it's interesting, but the industry and the science has really moved on and looked at things more broadly. If you're very young and your skin is very healthy, you might be able to click this first domino, arguably in the chain, and your body will fill in the rest, and it's okay. And this might be better than nothing.
Mm-hmm.
And not to say it doesn't provide benefits. I think we know the platelets do provide more factors than typically you're going to get from fibroblasts, right?
Right.
So you have the fibroblasts that are kind of covering this middle section. But there's these gaps, right? And
Right.
I talking to Lori and listening to her experience, it felt like maybe she kind of fell into this where there was this inflammation gap in the middle
Yeah.
and was really dependent on her own biology to close the gap. And when you compare that to, say, something that's going to cover the whole gamut here, that's more of like a
Right.
progenitor cell, skin progenitor cell, or stem cell derived, it makes more sense that this is going to move you through because it's not depending as much on your own biology, right?
Right.
Yeah.
Right.
Yeah.
Makes so much sense. Great explanation.
That's
Thanks.
where we get much more consistent results, for
Yeah.
sure.
Well, and the other thing here, going back to what I was saying before about picking the right cell source, I think most people inherently understand the importance of age. And, I say to people, if you needed a liver transplant and you had an 80-year-old liver or a 15-year-old liver, which would you choose? Most people would gravitate towards the 15-year-old liver. They don't need to be a biochemical engineer to understand that those younger tissues have inherent youth in them, right?
Right.
And
Yeah.
so the science has been pretty clear. There are age-related changes in the plasma, in the EVs coming from plasma, in the EVs coming from bone marrow, including your bone marrow mesenchymal stem cells. There are rejuvenating effects that can be seen generally coming from younger cells. Um, and that there is this pretty well-known thing now where a long time ago, I think this was at least 10, maybe 15 years ago now, they intertwined the blood systems of a young rodent and an old rodent. And, they made this older rodent have better metabolism, better fur, better memory,
Yeah.
and it had all this youthfulness. And people got really excited and thought, ooh, I just need young blood to make my old body young again. And they kind of overlooked the fact that really the old blood was going through this young rodent and it was being filtered by the organs and everything. It wasn't just about the blood, and it's much more complex than that. I think, when we were chatting before, we talked a little bit about Brian Johnson, who's getting fairly well known out
Yes.
there as a longevity guy who did this
Yes.
with his son. He was taking his son's blood, giving his blood to his father,
Yep.
and after a couple rounds of that, he discontinued it. And I think it's they understand that there's only so much that you can get from this young blood, and it's a bit more complicated than that. But
For sure.
younger is better in general.
Exactly.
So this is kind of the big takeaway is if you're going to be looking at a cell source, how young is that source? If it's coming from someone who's got a health status that is not as good as your own, someone older than you, less healthy than you, do you really want cells from that person? Do you want exosomes or secretome from that person? Probably not, right? At
Right.
least in this one paper, and there's probably more that have been published since, there was some evidence that the exosomes from older cells not only didn't help younger cells, but in some cases can have a negative impact,
Wow.
right?
Wow.
So it's something to think about, right? You don't want an older source if you can help it. And I think that's, again, common sense when you stop and think about it.
Of
But I
course.
don't think these are questions being asked all the time.
No, because some of the products are that I'm thinking of right off the bat. Some of the platelet-derived products are they've obtained it from blood banks, and they're various ages of individuals.
Yeah.
So it's not just young people; they're getting platelets from a widespread age
Right.
diversion of people. So that's very interesting.
Yeah.
That how can you control for that?
Yeah, I
Yeah.
think that sometimes they just look at it and look at the end product and say, look, this end product extrapolated can do all these things, not looking at the big picture, which is the source of it really matters, because if it's age, you're not producing as great quality of it
Right.
or as potent stuff versus a younger source like an umbilical, which I'm a big fan of umbilical stuff, is really the purest source, on the aspect of it. So, no.
Yeah, and that's kind of where my journey led me. I started off where, if you remember, George Bush banned a lot of stem cell research in 2001, and I happened to be over in the UK where that wasn't an issue, but I knew this was going to be a persistent issue, and I said, how can we make stem cells without, any embryos involved? And my doctorate was all about induced pluripotent stem cells. I got to meet some, really interesting characters, including Ian Wilmot, who you might know from
Yeah.
Dolly the sheep. He cloned Dolly the sheep. He was kind of thinking on the same lines of how do we turn back the clock, and we're seeing that work now continue on into a lot of David Sinclair's work now. But effectively, I moved from more what are called pluripotent stem cells that can become anything, that are much more like the ones that you at the very beginning of life, to mesenchymal. And I originally started with adipose because adipose tissue is easy to get, right? Every plastic
Right.
surgeon is paying to dispose of a liposuction aspirate, and about 1% of that fat is mesenchymal stem cells. So I first made products with that, but over time and really following the literature, said, what could be better? Younger is better. And that's where I arrived on using Morton's jelly, using from the umbilical cord, right? Both
Right.
because of that very youthful source being arguably the youngest ethical source that you can pull these mesenchymal stem cells from, but also, it was done through C-section, so the cord is almost removed in a surgical manner, so you can get very clean cells, and that's another thing is understanding whose lab are these cells going through, how pure is it, how clean is it, are they using the kind of GMP standards that need to be happening? They should all be running that through standard viral panels and microbial panels.
Right.
This is kind of basic safety for anyone in this field, but
Yeah.
if you're buying it from some random unknown source, there could be dangers there. I would like to believe no one is out there maliciously doing anything that shoddy, but it's worth asking about, right?
Hmm.
Right.
So
Yeah.
yeah, this to your comment, this is an example of some work back from 2015 using mesenchymal stem cells. These are very early, kind of similar to what you might get from an umbilical cord or placenta, and they're showing in the left here an artificial wound where they're growing a monolayer of cells and they're literally scratching on the plate that they're growing on like an artificial wound and then watching how quickly that wound heals in the laboratory and showing that exosomes from these mesenchymal stem cells are closing that wound more quickly. And that's what got a lot of attention. And that was repeated on actual skin. And it was shown that there was reduced scarring associated with this. So again, that led me to make products with mesenchymal stem cells from a very early source, what we refer to as an age zero source, and you could get results like this where you're seeing within a few hours the redness really decrease after something like radiofrequency microneedling. I think what was really more interesting to me is that while that was what kick-started the interest in exosomes, you can bottle these exosomes if you know what you're doing. And to stabilize and package these so you have an off-the-shelf solution, particularly one that you can use at home, I think is really powerful
Right.
because, again, the healing doesn't end when you get out of the chair, right? You need
Right.
to continue to foster it. Just like if you had a bottle of multivitamins at home, you wouldn't down the whole bottle on day one. You space it out, right?
Hmm.
And so the ability to package these in a shelf-stable formula became very interesting.
Yes.
The other thing I think is a kind of newer, very cool technology here is around extracellular matrix. So I
Hmm.
talked a lot about the scaffolding, right?
Right.
And this is a technology that was FDA cleared in 2018 that's recently brought into aesthetics. If you're familiar with things like ACell,
Hmm.
they were using urinary bladder from a pig, basically,
Right.
and drying out the matrix there, but it's mostly just collagen in there. And really, the scaffold is not just collagen. You need this more complete mix.
Right.
And so effectively, they created what they call their multi-tissue platform, which is a blend of a few different tissue ECMs that's more complete. It has laminin, fibronectin, elastin, collagen, and it's loaded into this powder. And then they took it another step forward and made it now into
Wow.
a gel. But if you've ever seen some of these images, I was really impressed by these personally, where you had an oncology patient with a flat breakdown here, and normally you might need a skin graft. But
Right.
by putting this more advanced ECM powder on, you can see it's
Wow.
starting to close by day 3. By day 6, it's closed. By day 21, it's reepithelialized. And by 6 months, you really can't see much. And there's even some hair still growing in this area instead of a really nasty scar.
Yeah.
And, this would probably be, I guess, say, a skin graft normally.
Right.
Um, and this again, in aesthetics, hopefully this is not the kind of patient that you're seeing, but the fact that this kind of powder can be used in necrosis with volumetric tissue loss, the from here, day 0, this is day 4, this is 1 month. This is really allowing things to
Wow.
rebuild. This is throwing that scaffolding right into the wound bed so the cells can get in and crawl up that scaffold and do their work very quickly and really repair and replace some of that volume loss, which I haven't seen with any other product. Um, and this is an example over a synthetic implant. So there was concern that the implant might be lost. You see a little powder was added there, and 3 weeks later, this is healed, very minimal scarring, saving the implant. That's a really big deal in aesthetics, right? In the wound
Yeah,
care
for
world,
sure.
compared to what we just saw, that's not a very big wound, but you
Right.
can imagine how life-changing this can be. And so the real advancement that was, like say, this was approved in 2018 as a medical device, but recently it's been made into a gel form and is being used in aesthetics, is really designed more for some of these aesthetic procedures, which makes it even more easy for the wound bed, easy to use. And they're doing a lot of different research applications on this right now. But this was a great one on a Mohs patient where you have like a quarter size non-healing wound on the forehead. And within a month, it's completely closed and very minimal scarring there.
Yeah.
Yeah. Like I saw this, I thought, wow, this is really cool
That's
technology.
that's really cool.
That's amazing. I think we need this in like a gel mask.
Yeah.
Like
Right.
one of
No,
those
I need a bath
one
in
of
it.
those masks that after a procedure we just put the mask on somebody.
Bathe
we,
in it.
we
That's
need
what
a
we need.
yeah, we need an ECM mask is what we need.
Be frozen in some jello like this, right?
Yeah.
Right.
Well, so you can imagine like CO2 laser, this is really helpful. And you can be more aggressive when you have this ready to go
Right.
scaffolding. So
Right.
instead of coming in with a product and
Wow.
saying, hey, wound bed cells, I need you to make collagen, I need you to make elastin, laminin, fibronectin, and you're waiting for your cells, your aged cells, to produce this in enough amounts and then build that scaffolding up. It takes time. And all that
Yeah.
time you're sitting there in pain. So
Yep.
the other main side effect here, a positive side effect here, is that they noticed that the pain was drastically reduced. So
Uh-huh.
you can potentially do more, aggressive procedures and get healing much more quickly. So
Wow.
again, this is another new tool in the tool belt. And if you've used things like ACell in the past, it's a similar idea, same inventor actually, but it's much more advanced and really allows you to, treat things in a new way. Like I think patients that want that aggressive result, but they don't want the aggressive downtime and pain, this might be a good
Wow.
solution for them. This is a last one here on the neck post RF microneedling. So
That's
because this gel also contains within it growth factors and exosomes, you get this very rapid reduction in redness as well. And it's kind of forming that scaffold right away. So again, I haven't seen anything that can really push the healing speed in that section of the four phases like this
right.
can. I'll, without, giving this away, it's trying to keep this very CME. It's not cheap. And so it's something that you really want to use probably more for the more aggressive procedures. The last technology I wanted to highlight here is around skin progenitors. So you remember on that four phases, we talked about stem cells and and progenitor cells. So this is a skin progenitor. This was published a few years back in the JDD by Vrelos and Mary Lupo, and they showed a 12-week improvement in these kind of fine lines and wrinkles around the eye, which are very difficult to deal with. Got some really great results quantitatively. And I think we've all seen some great before and afters. But what I really liked about this is they took it a step further and did the histological analysis. And you can really see what's going on beneath the skin here. And you don't have to be a histologist really to see some of these improvements. This is after 12 weeks of topical application twice a day. But you can
Wow.
see here, the improvement in redness, all this extra red, this is extra collagen that's being produced after 12
Wow.
weeks of topical application. Um,
Beautiful.
and here they have filaggrin. So filaggrin is going to help reduce your transepidermal water loss. You can see it's right there at the barrier. These sort of things that don't get talked about a lot are integral for having, good skin quality. They also claim to be the only product that has Phetuin A in it, and this is because they're really trying to make, like, if you think about the compendium of, starting off as a stem cell that can become anything, a pluripotent stem cell. You move into kind of a more of a stem cell that can become a handful of things, what we call multipotent. These are more like your mesenchymal stem cells. From there, you move into what we call a progenitor cell. So this cell maybe can become the different types of cells in the skin, right? It doesn't become a whole array of things. We know mesenchymal can become bone and blood and fat and muscle.
Right.
The skin progenitors are more narrow. So when the skin's first developing, this is the sort of cell that is the first cell as it's getting laid out, and it's like a very skin specific stem cell is maybe the way you can think about it. And it
Right.
produces naturally Fetuin A. And so if you look at Fetuin A and what it does, it's a bit like a shepherd. It's grabbing onto these great molecules that are otherwise unstable and break down
Take a picture.
and helps to get them to where they need to go. And so it's similar to exosomes in the fact that with exosomes, right, the exosome is the protector, it's the envelope, and what's inside really matters.
Right.
Here, it's a Fetuin binding to some of these factors that otherwise would get chomped up or broken down more easily.
Okay.
So, all in all, to kind of summarize here, I think we should be doing something at home before treatment. We
Right.
probably should be doing something at the time of treatment and something, at home afterwards. And the most basic thing is probably HA serum, Aquaphor or HA at the time of procedure, and HA serum at home. But I think most of the folks here, probably more advanced than that, already using peptide serums or growth factor serums or maybe stem cell derived. Immediately post, you could be using something like a PDRN or polynucleotides or platelet derived, whether that's PRP or platelet secretome or exosomes. This is good, right? We talked about why this might be good, but not great. And then again, you can continue these at home. From my perspective, you really want to have something on the front end and the back end that is more complete. And so that's where you might look at a stem or progenitor cell secretome or exosome topical. And then at that time of treatment, that ECM component, not just the signals, not just the messages to the cells, but the actual scaffolding, you might want to use that right at the time of procedure, particularly if you're doing something more aggressive. Does that make sense?
No.
Yeah,
Completely.
where can
need
I
it
buy
all.
that?
Where can I buy that?
Where do I order that? Yes, and yes.
Yes and yes.
Yeah,
For
so
sure.
this is just a little sampling of things. Obviously, there's a lot more we can talk about and dig into here, but I, try to keep it high level and not make it about any single product. But the treatment protocols should be personalized. I think you're always been a champion of that, like really looking at the patient, making sure that you're doing the right thing for that patient, and it's about that patient and that procedure. And as we already discussed, not all products are created equal. I don't
True.
think number of exosomes is a good marker. I don't
No.
think saying we have 1,000 factors, 2,000 factors, however number of factors. There's not a black and white easy way to do this. More is better, and I think that's what I'm seeing a lot of.
And you know what? Like
what's-
Jordan, like our cells have a limited number of receptor sites.
Yeah.
So once we load those receptor sites, the rest is just wash away,
Oh yeah.
right? So it's kind of it's just overkill in a way. And at what point is that tipping point?
It's expensive. I mean, this is
Right.
why a lot of people refer to vitamins as expensive urine, right? A lot of the
Yeah.
things that we take in are over the levels we need. And I think that unfortunately we got into this more is better argument on so many of these products when you're
Right.
comparing. And it's not a great argument, in my opinion. It's not
Right.
serving us as well as possible.
Yeah, it's very true.
But numbers sound good. I want 5 trillion of whatever it is you're selling, even though I have 5 receptor sites to receive whatever it is. All
I'm
right.
sure it's much better than that. But yeah, these receptors do get filled, and you can only do so much. And again,
Right.
this is why I'll often make the analogy that if you're at the end of your Thanksgiving dinner and I show up at your house with 3 more turkeys, are you going to eat those 3 more turkeys? Probably not, right? Are you still going to be hungry the next day? Yeah, you are, right? So you can't just shove a ton in at one time and expect to get all the results. Like it's a process. And in other areas of medicine, you wouldn't do this, right? Like if somebody said, hey, you're a candidate for hormone replacement. I'm going to give you this testosterone supplement. If another doctor came along and said, well, I'm going to give you 10,000 times the amount of testosterone, you should be concerned, not excited,
Yes.
right?
Right.
Yes.
So,
Right.
and I covered this, younger is typically better than older.
Yep.
Unfortunately, when you're getting the source, there are limitations, right? Some of these are coming from a source that is, a pluripotent source that can be divided and divided and divided. Others are coming from a source like a bank of cells, and there's only so many, and they have to keep making more. And they might be coming from people of different ages. So
Yeah.
those
Yep.
different age donors can lead to donor variability and batch to batch variability of the product, right?
Yep. Exactly.
Um, Generally speaking, my point of view is that stem cells and progenitor cells are better than platelets, and that kind of matches
Sure.
up with the four phases. I think there's a lot of people that still believe that platelets are stem cells or that they're getting stem cells when they're getting PRP. A lot of people are confusing exosomes with stem cells, not understanding the difference there.
Mm-hmm.
And I will say platelets are generally better than fibroblasts. I think this whole cascade started back in 2001 with TNS serum. I think hopefully everyone here is
Yep.
familiar with that.
Mhm.
In
Yep.
Medica, came out in 2001, and
Yep.
I always tell people I could train you in an afternoon to make what is in TNS serum very quickly, very easily. But it's not easy to do things with stem cells. It
Yep.
looks and feels similar, but it's actually very, very different. Um, and these fibroblasts only produce a few things. The platelets are producing much more, and the stem cells much more than the platelets. And again, lastly, more is not better. We want that complete and comprehensive. Anything that you're missing is going to be a bottleneck, right? If you're missing
Yeah.
one vitamin, your body is going to be bottlenecked at that vitamin until you provide it, or your cells figure out how to make it. And we want complete and comprehensive, not just a ton of one thing or a few things, right?
Amazing.
Right.
No, this
Right.
all makes sense.
I think, Jordan, I think this is perfect. Like our key takeaways are,
Yes.
we need to know where our products come from. Where are they gleaned from? Are they young cells? Are they older cells? Are we doing PRP on from drawing blood from a 65-year-old or a 25-year-old?
Right.
What's the quality of the cells that we're getting?
Yep.
And is it platelet derived, which we know now will help us in that early phase of wound healing, but doesn't take us through? And if we have somebody who's 30, their body might take them through. If we have somebody who's 55, their body might not take them through those phases very well.
Right.
So I think it's interesting how I think these products, everybody has good intentions,
Yep.
but it's good for us to know, like, wait a minute, where can I have a product that will work well for the majority of my demographic?
Right.
Not young, not old. Like, what is going to be consistent in the replication of my outcome, and what can I utilize that will be very consistent in not only the product I'm getting, but the outcomes I'm getting, the results I'm getting.
Yeah.
Yeah.
So
And that's a good question.
some of the questions, like even plant sources, because you hear people like, oh, we're getting exosomes from plant source. There's no real or plant stem cells. What are-
Roses, right?
Rose stem cells, all of those things. What are your thoughts with regards to that, and what's the science behind that?
I mean, I'm not a botanist, so I don't want to like pretend that I'm an expert on plant cells, but plant cell biology is very different than human cell biology. And I usually again use the analogy here of if someone came and cut the branch off of the tree in your front yard, would you go run out and rub your blood onto that tree in hopes it's going to grow back? Because that's kind of what we're doing in reverse here, is expecting to pull something from a plant and it impact our biology. And the other way to look at this is, are they using these things in the clinic? Because if they're not using a plant-derived thing in a similar way in the clinic, then it's probably because there's not any science behind it. It doesn't actually work, because if it did, it would be cheaper, better, and we would be using it. And so I think there's places like aloe vera where there are a lot of great vitamins and benefits to it, but it's more accidental than the fact that it's matching our biology, right?
Okay.
Right.
Is it safe to mix exosomes, stem cells with something like a PRP or Sculptra or Radius? Thoughts on that? The potentiation of each. Does it potentiate? I mean, I know I went to a conference and they were talking about mixing, was it PRP with Radius as a hyperdilute, and they did show a little bit of potentiations on the aspect of it. So, thoughts on that aspect of it? I don't think it destroys it, but is there a potential synergistic aspect to that?
Yeah, I mean, again, with these things like Radius and other products, it's a very concentrated of one specific molecule mixed with this kind of blend. I
Milieu.
think it's probably not been studied very well, and
Right.
probably not something to be the making your patient the guinea pig on. That's my point of view, right? I think you can do a lot of mixing exosomes into different formulations.
Okay.
Um, but generally speaking, if biostimulation with one product and then you're adding another one, mixing it together, you could get, weird results. I wouldn't put the patient in that position.
Okay, that's
Yeah.
interesting. Okay, because I mean, there's other things with regards to even your polynucleotides on that aspect of it. Where does that fall in your healing cascade? Because it does decrease inflammation, supposedly decreases melanogenesis. It works on the adenosine A2A pathways. Thoughts with regards to that in comparison to exosomes themselves? Because we're
Yeah,
starting
I
to get
mean, to be fair, it's something that has been around a long time. I think
yeah,
this has been
exactly. It's
around
from the wound
from like the
healing from
90s or 80s in Korea,
yeah,
right?
15, 20, 15, 20
Yeah.
years I think from the wound healing world. Yeah.
Right. And so, on the one hand, I think it's getting a lot of acclaim right now as the new thing in America, but I think
Yes.
outside of America, it's not seen as this cutting edge technology that is being
No.
sold as right now.
Mhm.
I do think there is evidence it is down regulating inflammation, which can
Right.
be helpful in some situations. But, you have to remember your body is built to kick out foreign DNA. And that's effectively what this is. They're getting salmon sperm DNA or trout sperm DNA. And, the name polynucleotides, it means that they've just chopped up the DNA into random bits. They've powderized this, they've put it in a formula. I think from an immune system point of view, when they are injecting this, which I've seen done, and I don't think is you're supposed to do in America at this point, but I've
No.
seen it done. Your immune system is kicking it out, right? Just like if you had a foreign DNA from anything else, any foreign viral DNA, or your body is very good at identifying this is not human and kicking it out. And in the process, it might be cleaning out the area. Those immune cells that have responded to that might be kind of doing some housekeeping in the area, and that might be driving some of these effects
The
other than
body.
just the downregulation of the A2A and the inflammation pathway.
Yeah, I mean it's very interesting because yeah, I mean I've seen it in Korea that they've done it and it has done well as far as what they've done, and that's how the Koreans get their glassy skin and stuff like that. So it's very very interesting. Now, if people are interested in getting into this exosome stem cell world as far as product wise, what out there can we use or how do we evaluate? Because there are so many quote unquote exosome products that are starting to jump into the marketplace on that on the US. As I listening to this is that like yeah, I want to do the stem cells, I want to do the exosomes, but who do we trust? Because that's the hard part.
It
Right.
is.
Every
It's really tough. Yeah. Yeah. I mean,
any
He's trying not to talk about brands.
I know
So,
you're trying to talk
so
about it.
Yeah,
can we can we look towards more towards umbilical derived H0, exosomes? Like would you not in a brand, but would you guide us towards what might be give us the most consistent product and outcomes that would be
yeah,
good?
sometimes in these presentations I've given before, I'll give a list of questions and maybe we can follow up with that. I think there is, unfortunately, a long list of questions that you should probably ask as a practitioner, and depending on how you're using them, right? I think we all are aware that at this point you shouldn't be injecting exosomes in America,
Mhm.
and that's specifically why I developed topical products for this. I do think there is a bend towards the stem cell, the younger end of the spectrum, because of, again, those age-related benefits. I think that makes sense. But certainly, who's behind it, who's making it matters, right? The quality matters. I don't believe that anyone in aesthetics today that is selling to the medical aesthetics community is doing so with like malicious intent. And I think there are certain things that people bring up as concerns that would only happen if someone was really trying to do a bad job. Um, but maybe I can follow up with that list of questions and you can share that with your viewers on things to ask. Because again, it's what cell is it coming from? What do you know about that cell? Is it tested well on the front end? It should be tested for viruses, should be tested for microbial contamination throughout the process. Do they have any stability data? A lot of these machines that look at exosomes, they're looking actually at small particles,
Right.
and they're telling you the number of particles, not the number of exosomes. So you have to validate that those particles are intact exosomes. That requires a special microscope, and most companies and places don't have it. Like we outsource to university labs at times when I wanted to do that kind of work because it's very expensive equipment. So there are some shortlist questions we could have people ask.
And then what about those people that are against exosomes or stem cells, saying that it could potentiate cancers and all of these other bad
growth
things
factors.
or growth factors?
Growth factors.
Thoughts on that, and how do you explain that?
I think a lot of people get into the mindset that a growth factor equals growth. And I think in some ways that's a bit of a misnomer. These are proteins like any other protein. They are supporting healthy cell turnover. If you overdo a single growth factor, like there is a past precedent that if you have a wildly high amount of EGF, that can be bad, right? The other thing is that a lot of those studies on a single growth factors or things tied to negative impacts were made in a recombinant way. So they took an E. coli bacteria or something similar. They changed the genetics of it so that it produced this EGF or FGF in a large amount. And they don't realize that when you're using a bacterial vector, they don't have a Golgi apparatus or an endoplasmic reticulum. And so it doesn't get folded correctly. It doesn't get the right cap and tail sequence. And so it doesn't have the full function. Sometimes it's not functional at all, right? And so unfortunately, aesthetics is sort of the victim here because in the pharmaceutical world, there's a higher bar to be set, and some get away with trying to pass off these things that don't meet the pharmaceutical bar as an aesthetic product. So to go back to your question, I think it's a complex one. I think people like to believe that it's like a set of dominoes where A goes to B, B goes to C, C goes to D. But if you really open up and look at any of these cellular growth pathways, they're very complex.
Right.
And this is again where I believe a mixture is actually better than a single molecule. And I think that we, as a group in aesthetics, will often oversimplify exosomes as like a bag of growth factors. And it's really, that's not the most accurate way to think about it. I can tell you anecdotally, I have personally and seen others where they've taken precancerous cells like AKs and reversed them with topical exosomes. And I know plenty of people have really great stories like that they've seen. But at the same time, like the products can't really say anything. You can't market to those type of stories. And I think if anyone making these products genuinely believed that they were causing cancer, they wouldn't be making them. So I can't say definitively that this has been figured out, but I think if you have active cancer, you should be running everything past your doctor that you're putting in or on your body. And I think most oncologists would say better to just not do it just in case. But I don't think that these are promoting or causing cancer. I think that is something that you have to remember. A lot of companies are getting displaced in the market by exosome and secretome companies. And this is, they're going to defend their territory. And a lot of times, unfortunately, that's through fear.
Yeah.
Yeah.
For sure.
Yeah. I think a viewer, Karen, was asking thoughts on insulin in wound healing. And as we kind of wrap this up, there are a lot of articles on insulin and wound healing with insulin potentiating wound healing, which is phenomenal. So yeah, we have articles with utilizing it with microneedling, and it potentiating that healing. So that's a good question from Karen. But yeah, there's quite a few articles on it really, really helping with wound healing, which is interesting. Yeah.
I think
who would have thought?
Yeah, I think that we're still learning all the time on these different things, right? I think it makes sense that we know we shouldn't be having a high sugar diet. We know that sugar is causing glycation and this hardening of our proteins. So you can imagine at the wound bed, if you've got glycation, you're going to slow down healing. So it does make some sense that insulin at the wound bed is going to fight those negative impacts of sugar, and especially because a lot of us have a lot of sugar in our diet, more than we probably ever should.
Right?
Very
Yeah.
true.
And inflammation, cardiac disease. Hello. It's not cholesterol, people. Anyway, let's not get on to that.
There's a whole world to that.
Gosh. Okay. We're
All
learning.
right,
We're learning
well,
a lot. Jordan,
We've
thank
learned
you
so much from you.
so much for being
Jordan.
here.
Thank you so
Thank you
much.
for having me.
You guys have his contact information. Ask him questions. If not, reach out to us. We can get you his information. But thank you so very much. That was so
great.
insightful. I think
Thank you.
everybody learned a lot from that aspect of it.
Yeah, they're gonna rewatch this on YouTube later and get a notebook and write
We're
it
gonna
down.
put this on YouTube, so if you miss some things, it will be on YouTube in probably a week or so, week and a half or so. But let's see, May 6th is our next AI Live. It's at 5 p.m. and we're gonna actually talk to people that are actually producing PDGF. So we're going to talk about the platelet-derived growth
yeah,
factors.
so right, so we kind of touched on that subject too. So we see a lot of people social media and such injecting PDGF, and we're going to bring Dr. Lynch on, who is someone who started this whole company, and kind of get the real scoop from him. So that's going to be on, when is that? May 6th.
May 6th, 5 p.m.
Yeah.
All right, guys. We will see you next
All
time
right.
on AI Live.
Thanks
Bye,
for
guys.
joining.
Thanks for joining.